Almost 35% of adults in Singapore are walking around with untreated tooth decay. Singapore has more cases than the global average, which stands at 27.5%. But here's the thing, there's no lack of dentists here. We have one dentist for every 2,000 people, a figure that's like other developed countries. The World Health Organization wants to reduce oral conditions by 10% by 2030. Now, measures mostly target poorer countries with limited access to dental resources. So why is it that Singapore, a developed nation with over 1,000 dental clinics, seems to be falling behind in dental health?
I'm ready in 5 minutes.
Okay. Thanks so much, bro. Hey, Dixon! So nice to meet you, man. Thanks so much for being on the interview.
Shall we take a selfie first?
Oh, yeah, sure. The price of this smile? 12,000 Singapore dollars. This is what 36-year-old Dixon Teo missed eating the most when his teeth ached. Tell me, your teeth cost you $12,000. How come?
I've done around 8 procedures, 4 root canal and 4 dental implants.
So just to be clear, none of these procedures are cosmetic procedures, right?
No.
When did you first realize there was a problem?
When you start to feel that the teeth is just hurting, and that's where you know that it's something bad. And the first time I went to the clinic, then they say, well, you have one place that hurts for you, but actually there's many problems, so many decays.
Okay.
Yeah, so I rarely go to dentist before all these dental problems, like maybe once a year.
But in those 12 months, what happened?
It was a combination of many things. A lot of good food, of course, and I had a lot of sweet desserts like ice cream and all the very sinful kind of mango sago, pomelo sago kind of food.
Now I'm feeling guilty to have this.
The worst part of it is it's expensive. Root canal, it depends on the molars or how to do the front tooth. One tooth is around $600 to $900, yeah, around there. Dental implant is the most expensive.
Roughly
and
how much?
one. It was around coming to $2,000 over dollars, yeah, 2000, 2005.
That's for one dental implant?
One dental implant.
Oh my gosh, and you paid all of this out of pocket?
Out of my pocket, definitely. My company has insurance, but it's not a lot. I spent $12,000 over a span of 3 years, and my company can claim around $200 a year.
So total, you only claimed about $600 for the whole 12,000. That's what, 5% of the total cost? Oh my. Why didn't you go somewhere overseas to get the procedures done, or go to a public dentist or something like that?
You don't really have much time to think about it. The pain just gets you every night. It's like so difficult to sleep.
Yeah.
You had to eat Panadol to sleep. That's difficult. So I had to go to a private clinic at my nearest time. And after that, I just go for wherever the dentist want me to do.
How often you visit your dentist depends on your risk profile, genetics, what you eat, and your history of tooth decay. Dixon was visiting the dentist once a year, but with his sweet tooth, that might not have been enough. Each time we feast on sugar, something else feeds on it, the bacteria in our mouths. They turn sugar into acid. This eats away at the enamel, the protective layer of our teeth. The acid attack happens for up to 30 minutes after each sip or bite. Over time, it eats further into our teeth. The last time a survey was done on our oral health was in 2019. That's 6 years ago. I'm on my way to meet someone who has spent 3 decades championing more accessible oral care in Singapore for the lower income and the elderly, Dr. Eugene Tang. Dr. Tang, this survey was done in 2019. So since then, has our oral health remained the same or it's gotten worse?
from our experience as clinicians, we see that the problems has not gone away. Basically, the problem of tooth decay and the periodontal disease is very much staying in our community, despite of whichever age group. So in that sense, I would say the national average rate of decay and periodontal disease probably hasn't changed very much. Well, if you look at the National Health Survey, right? Of course, the elderly are carrying the heavier burden, but those in 30 to 40 are also having that data recorded. They also have a fair share of oral health problem. For example, they are under stress, so they snack a lot. Or they may like sugary drink, and after the sugary drink, what do? They don't, no time to brush the teeth, no time to floss the teeth. Let's say you are 30-something years old. What is the priority? Your priority is to make sure you can own a home, your career got to settle everything. So your priority is not going to be dental health.
Why do you think is Singapore's state of oral health so dismal for a developed country?
Just because Singapore has got high national income doesn't mean they have got very high oral health standard.
According to the same 2019 survey, while more than 50% of Singaporeans visit the dentist at least once a year, 8.4% go only once every 2 to 3 years. 34% go only if they have a problem, and 3.3% have never been to a dentist. That makes 46% of us who don't go to the dentist at least once a year.
I can't quite remember when's the last time I've been to a dentist.
The dentist cost is rising now currently in Singapore, so that's why I don't go as much often as it's supposed to be.
Hello, I just wanted to get a sense of the prices of some of your services. I was actually thinking of doing something like a root canal. Wow, the prices, they've gone up since the last 5 years. And consultation fees? Has that changed in the last 5 years? At private dental clinics, scaling and polishing can cost between 65 and 180 Singapore dollars. 5 years ago, this was about 50 to 160 Singapore dollars. Scaling and polishing is one of the most common dental services. But there is a wide range of other services available. And in a sector fragmented by private players, no one is really keeping track. We did a snap poll to find out what stops someone from going to the dentist. Out of the over 1,000 people who responded on our various platforms, a whopping 57% said it's just too costly. Dr. Daniel Goh has 6 dental clinics under his belt. They are in HDB estates like this and in a mall. His clinics have increased prices twice in the last 5 years. Doctor, so roughly by how much have you had to increase your prices each time that you had to do so?
By about 5 to a maximum of 10%. We only do this for the more complex procedures like root canal treatments. For root canal treatments, the material costs have gone up. So unfortunately, we have had to increase the prices to consumers. Coupled with that, also there's new technology, new machinery that we have to purchase. We need to pass the cost of these new machines on to the consumers as well.
So how do you decide which procedures to raise your prices on?
Okay, so it's actually driven by market forces. So we try to compare with the other dental clinics on the market. We try to price it to a similar level or just slightly below that of what they are actually charging. So for like root canal treatments and dental implants, these have risen steadily over the last 5 years.
And what would you say are some reasons that prices in general are just steadily going up?
So essentially, dental clinics are SMEs, so our biggest costs are always rental, manpower. Unfortunately, these have risen quite a fair bit over the last 5 years. Just to give you an indication, the rental over here for this particular clinic has risen from 10,500 to about 13,000, but that's only because when we signed the original lease with the owner, I built in this clause where we factored in a maximum of 10% appreciation at the first renewal. I personally know of another clinic which didn't have this clause, and the landlord has actually raised the rental by 30%. Okay, landlords have this hold over dental clinics because of the high cost of renovation and setup. We have had to rip up the floor to put in pipes because the dental chairs that you see, they have air and they have suction. The water goes out to the sewage. Coupled with that, the X-ray rooms are all lead lined, so it's very expensive to put a whole layer of lead around that room.
So landlords are the reason why prices keep going up.
Well, very recently there was a closed bid from HDB for a unit in Sengkang. It was just about 700 square feet, which is just about the same size as this clinic. We put in a bid of what I thought was quite high at the time, of 18,000. But when we found out the winning bid, we were quite shocked. So it was 37,000 a month.
So there are clinics out there that are willing to do this.
Yes, yes.
Tell me also about this manpower crunch.
Because of the very small pool of well-trained dental assistants, a lot of the dental clinics are actually offering higher prices to try and poach these trained staff over to their clinics. The salary costs, even for a non-trained person, is essentially 30% higher than it was 5 years ago. We have to either offer a higher salary or look for foreign manpower, which is also difficult given the quota system that we're facing.
Then how are dental polyclinics able to keep their costs lower?
Okay, so dental polyclinics actually fall under the restructured hospital conditions, whereby the government gives kind of a stipend to defray the costs of dental treatments to these polyclinics.
In Singapore, students get basic dental care for free through school-based or mobile dental clinics, as do full-time national servicemen during their time in uniform. Older Singaporeans, those in the Pioneer and Merdeka generations, get substantial subsidies. Lower-income households across all ages get support too through the Community Health Assist Scheme, or CHAS. But what about those who don't fall into these groups? That's where the gap lies. We do have public dental services at polyclinics which are heavily subsidized. Scaling and polishing for an adult Singaporean can range between 50 and 100 Singapore dollars. That can be up to half the price compared to private clinics. According to the Health Ministry, the median waiting time to book your first appointment at a polyclinic is 3 months. Let's try to book one now. I tried earlier to get an appointment in my neighborhood, and it was impossible. I'm going to try calling them.
What do you have in your menu?
Yeah, hi. I would like to make a new appointment for scaling and polishing.
My earliest will be next week.
Okay, and this is at Pasir Ris?
Yes.
I could get an appointment in a week's time. And as long as I'm willing to travel out of my estate, there were multiple polyclinics with same-day or next-day slots available. I wonder what young adults feel about this option. How old are you and what's your name?
My name is Vic, I'm 34.
I'm Tiffany and I'm 37.
I'm Ridwan, I'm 35. My name is Jintro, I'm 25 this year.
I didn't know there's such thing as a dental polyclinic though.
I'm somewhat aware, but I'm not exactly sure of the full extent. I've never heard of polyclinics having dental services.
I would consider polyclinic dental, but I guess my concern would be like the speed of making the appointments and how quick that they can attend to me.
Booking appointment probably like a month.
6 months to 9 months. Yeah.
I could get an appointment as early as next week. And in some dental clinics, I could get it within the same day.
Within the same day?
Within the same day.
Okay, I would want to try already.
Public dental services are simply not top of mind for young adults we spoke to. Though something else did come up.
How often do you go to the dentist?
Twice a year. Because my company provides dental welfare, it's claimable.
So I did go regularly for the dentist because my company did cover for some like 250 like insurance on the dentist like that.
Covering costs might encourage working adults to visit the dentist. But how many companies actually do so? And how much is enough? There is no available data on corporate dental benefits within the private sector. That's not something the Health Ministry tracks. So I'm going to, quite possibly, the only place in Singapore with oversight of this space. Q&M is Singapore's largest private dental healthcare group with over 100 clinics. 1 in 5 Singaporeans have passed through their doors. They estimate that about 20% of their patients have their dental bills covered by their company in some form.
So for corporate insurance, are there different tiers?
We can probably divide them into 3 tiers, okay? So agak-agak, okay, on the higher tier as charged, or maybe $1,000 more, you know what I mean? So these people are very well covered, okay? This usually includes the high-level management or even expats. On the middle, okay, usually you have the coverage at about the $400-500 range. And then also, quite commonly, you have anything from $200 to $300. You know what I mean?
So what amount of coverage would you say would be enough?
Well, I mean, the civil service is doing it at $250. That's pretty good. I mean, there's a good start to do your basic dental, at least get it checked and everything. So I would say anything from the 200 to the 500 mark will be actually very good.
So would you say that the middle level is what would be ideal for
I think
most
that
people?
is quite comfortable for most people, at about the $400-500 range. So that is the level that would definitely cover your maintenance. And if you got some basic dental problems that require fixing, you won't put it off till next year to use next year's claims.
Why do you think companies aren't providing a higher tier of dental insurance?
It's back to the awareness thing. Over the years, awareness is improving, so even companies realize that having healthy teeth is important, because when somebody has a toothache, they can't function properly throughout the whole day. So I think companies are starting to realize that this is an issue.
So this is an incentive for companies to pay attention to dental care for their employees so that they can catch these problems early and so that they don't compound to major issues like root canals that will take people off from work.
Yes.
And one of the biggest dental health challenges we face is gum disease. The problem is, you can't see it coming on your own. It's something only regular dental checkups can catch early, before it does lasting damage. Less than half of Singaporeans in their 20s have gum disease, but once they reach their 30s, that figure soars to more than 83%. That's over 8 in 10 young adults already affected. I'm going to meet an expert who's going to show me just what gum disease can look like.
So if you look at this patient, so this patient is about 28 years old.
Okay.
So what do you think of her teeth and her gums?
Well, I mean, I know there's a slight discoloring, but the gums look fine.
What about the side? So this is her right side, this is her left side. So what do you see?
I see some bleeding, a little bit, and I can see in between the teeth, it's sort of inflamed, there's a bit of redness.
Correct. But would you think that it's something so bad that her teeth will drop out?
No.
We will look at the X-ray now. Well, for this particular patient, if it goes untreated, yes, there's definitely a risk that her teeth might be loose and they might eventually be lost. For all these black spaces, this is air.
Okay.
Right? And if around our teeth we have a lot of black spaces, that's an indication that we are losing bone. Because for our teeth, the bone level needs to be quite high up, right? So that the roots of the tooth is actually anchored into our jawbone. So if you look really closely, our bone level is somewhere here, when actually normal bone should be here.
Oh no.
So she lost bone.
Wow, so this is a case for someone who's 28 years old, and you would consider this a severe gum disease?
Yes, we won't expect it in a 28-year-old patient.
So for folks in their 20s, 30s, 40s, is gum disease something that's we should be really concerned about?
Yes. It is accumulation of bacteria that hides underneath your gums. And it takes time to develop. in most of our patients or in the general population, about 13% of the population, it might be very severe. So depending on the patient's genetics, depending on the patient's health condition, and because it's a silent disease, right, you actually don't know. Right? Sometimes you get a little bit of bleeding gums, sometimes you feel that your gums feel a bit sore. So then for most of us, we would take it as, oh, maybe I'm too stressed. But the bacteria is breaking away all the attachment around the teeth, breaking away the bone. But it's not something that we can see just by looking at our teeth. Okay, so what about this particular patient? What do you think of his teeth and gums condition?
I can't look at it. It looks really bad.
Okay.
It seems like there's stuff stuck on it, on the teeth, and it's decaying. So it looks really bad.
Okay. Well, fair enough, right? For this particular patient, he actually is quite young. So he's 30 years old.
I'm trying not to gag,
We do a process that we call scaling and root debridement. And this is him in about 6 to 8 weeks' time.
So this case compared to the first one we saw, I would say this was more severe.
Well, for the first case, actually, it doesn't look so bad, right? But the bacteria has already broken down way more bone compared to this patient. Yeah, so for the other patient, even though it looks okay, it looks relatively clean, but her teeth are actually more mobile, so they're more shaky compared to this gentleman. So that's why it's silent, right? You cannot really tell.
I mean, how do you even tell then?
So that's why we need to see a dentist on a regular basis. Your dentist will be able to assess your risk profile. So then your dentist will do this risk assessment and then determine the period of time that happens between two separate dental appointments. If you have uncontrolled diabetes and you're a smoker, I would say maybe once every 3 months we get our teeth checked. If you are a low-risk patient, so you're a healthy individual, you brush very well, usually we can even stretch it to once a year or once every 2 years.
The government has announced increased dental subsidies for the elderly and the lower income from the fourth quarter of 2025. Hopefully this will encourage more people to visit the dentist. Fee benchmarks for common dental procedures such as scaling and polishing will also be rolled out. This will help all patients make their own cost comparisons. Now, these measures are aimed at improving our oral health, which perhaps hasn't been given enough attention as compared to our physical health. So, if you're watching this and you haven't gone to a dentist for over a year, it's time to book an appointment.